In the vast universe of viruses, a new player emerged in late 2019, COVID-19. This virus, unlike any other, quickly became a global concern. This novel coronavirus, scientifically known as SARS-CoV-2, took the world by surprise. It was a new strain that had not been previously identified in humans. It originated in Wuhan, China, and swiftly spread across the globe. Within weeks, it had reached every continent, causing widespread concern and panic. COVID-19 is a respiratory virus primarily transmitted through tiny droplets released when an infected person coughs, sneezes, or even talks. These droplets are the main carriers of the virus. These droplets can land in the mouths or noses of people nearby, making close contact particularly risky. The virus can also spread through contact with contaminated surfaces. When someone touches a surface with the virus and then touches their face, they can become infected. Imagine these droplets as minuscule, invisible projectiles carrying the virus. They can travel several feet and remain in the air for a short period. They travel through the air and can linger on surfaces for a period of time, making it easy for the virus to spread in various environments. This mode of transmission makes COVID-19 highly contagious as it can easily spread from person to person, especially in crowded or enclosed spaces. Social distancing and wearing masks became essential. Understanding how the virus spreads is crucial for implementing effective prevention measures. Public health guidelines and personal hygiene practices play a vital role in controlling the spread. Once inside the body, COVID-19 begins its invasion, starting a complex and aggressive process. The virus uses its spiky outer shell, like keys, to unlock and enter healthy cells, particularly those in the respiratory system, such as the lungs and airways. Think of these spikes as grappling hooks latching onto the surface of our cells, making it nearly impossible for the cells to resist. Once attached, the virus injects its genetic material into the cell, hijacking its machinery to create copies of itself, effectively turning the cell into a virus-producing machine. This process is akin to a hostile takeover, where the virus forces the cell to become a virus factory, churning out new viral particles at an alarming rate. As the virus replicates, it damages and eventually destroys the infected cells, leading to widespread cellular destruction. This cellular destruction triggers an inflammatory response from our immune system, which rushes to the site of infection to combat the invader. The immune system dispatches white blood cells to fight the infection, leading to symptoms such as fever, cough, and fatigue as the body battles to regain control. While COVID-19 shares some similarities with the seasonal flu, there are crucial differences. Both viruses cause respiratory illnesses, but COVID-19 has proven to be more contagious and often more severe. The flu typically has a shorter incubation period and generally causes milder symptoms in most people. COVID-19 also poses a higher risk of complications, especially in older adults and those with underlying health conditions. These complications can include pneumonia, acute respiratory distress syndrome, and multi-organ failure. Furthermore, COVID-19 can lead to long-term health issues, collectively known as long COVID, even in individuals who experienced mild initial infections. The rapid spread of COVID-19 placed an immense strain on healthcare systems worldwide. Hospitals faced a surge in patients needing critical care, leading to shortages of beds, ventilators, and medical personnel. The sheer volume of patients overwhelmed healthcare facilities, pushing them to their limits. This strain not only impacts the care of COVID-19 patients, but also affects the ability to provide timely treatment for other medical emergencies. The pandemic highlighted the importance of public health measures and individual responsibility in protecting ourselves and our healthcare systems. While the fight against COVID-19 requires collective effort, there are simple yet powerful steps individuals can take to protect themselves and others. These actions, though small, can have a significant impact on curbing the spread of the virus and protecting our communities. Frequent and thorough hand washing remains one of the most effective ways to prevent the spread of the virus. It's a simple habit that can make a big difference in keeping ourselves and others safe. Imagine soap molecules as tiny warriors breaking down the virus's protective outer layer, rendering it inactive. This visualization helps us understand the importance of using soap and water. In addition to hand washing, wearing a mask in public settings, maintaining physical distance, and getting vaccinated are crucial mitigation strategies. These actions collectively help reduce the risk of transmission. These measures act as barriers, reducing the transmission of the virus. Each layer of protection adds to our overall defense against COVID-19. By working together and adopting these preventive measures, we can navigate this pandemic and build a healthier future. Our collective efforts today will shape a safer tomorrow for everyone.